This is our third medical town hall, and we're hoping that, you know, we'll have a good conversation based on truly what your needs are and the topics you'd like to talk about. Dr. K and I are here just to facilitate the conversation. And if you have any questions, please feel free to jump in, ask away. There is the chat function on the side, which you're more than welcome to type in your questions or comments. We'll make sure that those are monitored in case there is a question that you'd like us to ask of the group. And we, of course, are taking notes as usual, and I encourage you all to do so as well. So again, my name is Matt, I'm sorry. And Dr. K she's next to me on my screen, but I don't know where she is in place of everybody else. But
I'm the one waving now like a big dork. You can see the hand moving.
Because that's what we do on Zoom calls.
Right.
So Dr. K, if you want to take over as far as our questions.
Sure. We just thought we wanted to kind of literally check in again with everyone. A couple weeks ago, for those of you that were part of this, you know, we had 2 really great, well-attended medical town halls, and got a chance to just talk about the things that we're all thinking about and what we have to consider for our camps. So we heard from the group that we wanted to do that again. So we thought we'd just start tonight. We're going to do this ideally every other week. If people are interested, we are here to facilitate, as Matt said. So if we need more or less, we're happy to adjust that schedule. But we just thought we'd start by throwing out, you know, how are people doing? I mean, this is a stressful time for a lot of things, for a lot of people, and wanted to see what people are thinking about, what you're dealing with, whether it's camp specific or just things that are on your mind, and ask some other minds to help share that burden, maybe answer some questions that you've got.
Hi, this is Deb from Camp-I Hope. Can you hear me?
Yes,
Yep.
Deb.
Okay. Well, we just had we met with our board at the end of last week, and then we met with our planning committee last night, and then sent out the information to our group, our parents, campers, and everyone that we were going to cancel for our camp session for June, well, for this summer, and then we're going to do virtual camp the same week that we were going to have camp. So we've just been dealing a lot last night and today, with just everybody's emotions around that. I mean, we believe it's the right decision, but it was, as you all know, very hard. But we did make a little video that we posted and sent out to our families that try and like give them some highlights of camp, and then sorry about that, that's my dog. And then to give them some, hopefully to raise their spirits a little bit about camp. So that's kind of where we're at.
Deb, who did you have in the video?
Well, we did scenes of just camp being empty because the campsite that we use is totally closed. And then we had one of our camp songs was playing behind it. And then myself and Renee, our other co-director, talked, and one of our senior counselors who works with our LITs, and then we just did a bunch of pictures of last summer to a song. I don't know if you guys have heard it, "Smile" by Sidewalk Prophets, talking about there's always a reason to always choose joy, and choose joy is one of our mottos that we've had since the beginning, and so we ended with that.
Very cool. Anyone else struggling with the emotions if you've made the decision of canceling camp? I certainly will say I am. I mean, I know we made the right decision and we've let our families know, but it just seems so strange to not have a camp coming up, and I'm not sure what we're going to do yet to try to replace it, but it's so weird.
Yeah, this is Tammy from Camp Fantastic Special Love. So we're actually announcing tomorrow. We haven't told our families yet, but we are all lined up to send out a notice tomorrow at noon that we're canceling Camp Fantastic. So we're and all of our programming until September. So we've let a few key people know, and so we've been able to kind of grieve collectively, start the grieving process. But I'm kind of bracing myself. I've been sitting here all day writing emails to people then and getting them set up to send tomorrow, and really dreading 12:01 p.m. when the emails have started to be received and the messages start to come back in, because I know it's going to be sad. But again, we feel completely comfortable that we made the right decision. So that helps. That helps somewhat.
And Tammy, your week-long camp is in August, correct?
Yeah, third week in August. But
usually it's the same week.
We just felt like with the uncertainty of everything that's going, the uncertainty of everything that's going on, and not really knowing, we were not so, to be honest, to me, it's not as much of a concern for the children as it is for the staff. Because there's a lot of asymptomatic carriers and in pediatric patients, and we were really, worried about being able, not knowing if the infection was getting ready to resurge again, and that we might be taking, children who have the virus into the camp situation and infecting adults. So there were a lot of factors, as we've talked about on these other calls, that went into the decision, but when it came right down to it, we just felt like it's the right decision for the safety of everybody that's involved.
Hi there, this is Avril from Camp Ooch and Camp Trillium in Toronto, Ontario, Canada. We actually made the decision to cancel all of our summer camp programs a couple of weeks ago. So when I attended the previous town halls, we had just made that decision, and our emails had gone out to our families, I think, on that day. And just, for Tammy, getting ready to hit send and sort of waiting for those replies. I will tell you, our experience was that families, they totally understood. And while they were sad, they completely appreciated the need for the decision. They appreciated how thoughtful the camp, like we were with considering their families, their children and the staff, and they completely understood the need to make that decision. So, yes, there was expressions of sadness, but overwhelmingly it was, thank you for keeping our best interests at heart. And we are sad for you as well, because we know how much your staff and volunteers love camp. So just know that it was actually, as much as it was an overwhelming and emotional decision to decide to cancel, it was also overwhelming and emotional to receive all of the feedback from the families. So it was actually nice. And we run camps all through July, all through August. We run city programs in the spring. We run day camps in July as well. And so we have canceled all of those things. So right now we're sort of weathering the now what, and coming up with virtual camp programs and getting that underway. And, as an organization, sort of shifting our focus on the work that we're doing as an organization. That's sort of what direction we've moved into now.
There's a question on the chat, since we're talking about letters and things. Kelly is asking, how much detail are you providing in these camp cancellation letters with regards to the rationale for canceling? Anybody want to speak to that?
I can let you know what we shared. We shared specifically that it was related to the global pandemic, and not dissimilar to the types of communications that you see coming out from many organizations, public health, local government, that it is around containment and safety. So we didn't go into a lot of detail, but we definitely sort of borrowed theme and language from all sorts of communications that most of us are seeing in email and on TV. And
Yeah, that's pretty much what we did too. We had kept it very short and sweet, but just kind of said because of the global pandemic that we're dealing with right now,
yeah.
and the ongoing issues, that their safety and the safety of our staff and campers and families was first and foremost. And so that's why we made our decision, and we can't wait to be, and then they put in a section about the virtual camp that they're going to be running, so that, you know, they've got a whole program that they're trying to work on, like everyone is, to keep the families involved and stuff. So they put a lot of look forward to, you know, check out our website and look forward to this new camp experience that's going to be coming for you.
I don't remember the specifics of ours, but it was similar, just with the virus and trying to keep everyone safe. We haven't determined exactly what we're going to do to replace our camp yet. So I think ours was similar to just saying we may try to do a short event in the fall. So keep in touch, and we'll let you know as soon as we have anything, any new plans in place or something to that effect. There's another question. Has anyone decided to postpone to a possible later date for their camp?
So, hi, this is Aaron from Camp Rise Above. So I think that question was from Ian. He's also in Charleston, South Carolina. But we do 4 weeks of camp for like bunches of different populations, and usually most of them are in June. We're considering moving all of them to July and early August, but I really put my hopes on that, but I think that's actually looking like it's not gonna be feasible, not even partly because of all the things that it takes to plan that, but also, and like just all of the planning that goes into it without the certainty that it's actually going to be allowed to happen, right? So, and then also the medical staff, the availability of them, you know, with us having 8 different sessions over 4 weeks, you know, that's a lot of medical staff that we ask for. And I think if anything, they'll just be getting back in the swing of their normal rotations and probably won't have the time off to come out. So, I want to postpone to later in the summer, but I think it's actually looking like the whole summer might really be off limits. If anything, we're thinking about maybe a family camp carnival day right before school starts in August. But that, again, it will be up in the air, but yeah, so that's kind of where we are.
Erin, do you own your facility or do you rent?
Yeah, so we don't. We use the county park, and ours are just day camps, and right now they're closed. So obviously, and that's something my coworker, it's just 2 of us, my coworker and I are, she's really good at bringing me back down. She's like, we can't even consider it if they're not even open. So right now, you know, they've articulated that they want to be open. They're kind of being like aggressive with like, we should be ready to go by like the end of June or whatever. But again, there's no guarantee. And so it would depend on them being open.
Right. Okay. Yeah. If you do get a chance, everyone check out the chat box too. There's good conversation going on there, just with similar things like Avril saying in Ontario, they can't have gatherings above 5, parks and playgrounds closed. So clearly that's not going to help anything. There's another question, Avril, what's the Canadian government saying as far as how long they're going to do no large gatherings? Apparently there's one governor in the US that said not until September. Oh, you're answering, sorry.
No. Yeah, I just, the federal government here is saying that the lockdown, that they can't answer that question, essentially. They're not going to give a timeline. They're not going to say how far out that this will go, but they do, you know, not dissimilar to probably all of your areas, you know, sort of daily updates, and they, you know, doing as best possible projections, but they qualify the projections with the longer out that you're looking, the less accurate it is. So, you know, like really what we have to go on is, you know, the next 30 days. Our schools were supposed to be going back. Well, the next check-in point was whether the schools would go back in May, and they've said that it will not be that, but have given no further detail on that. So, yeah, the communication is stay home. as much as possible, stay home. Don't go out.
We're dealing with now, for those of you that maybe have seen it, I'm in Sioux Falls, South Dakota, which is where the Smithfield meatpacking plant is. Currently the largest hotspot for its size in the
Yeah.
entire country. So, but we also do not have a shelter in place order for the state, and some other things that are driving most of us from the medical side insane. So it's been interesting around here.
Yeah, I feel for you. And I think that one of the things that we keep hearing that's coming out is that even when they decide that they're going to start lifting some of these things from an epidemiological standpoint, it's going to be rationed out of gatherings of 5 to 10 people, gatherings of 20 people. Further later, it's going to be gatherings of 50 people. So when you look at a production of camp, you know, depending on how large your camp size is, I doubt that those kinds of gatherings are going to be really encouraged or permitted for quite some time.
Agreed.
I did read today, this is Kara from Camp Happy Days in Charleston. I read today from the WHO and the CDC. They kind of put out some literature today, or maybe in the last week or so, about phasing. And one of them quoted that in order for lockdown you to come out of lockdown after a 30-day period, there has to be 6 criteria met. And that includes adequate screening. It includes low incidences and 14 days without a new case. And then even with that 30-day period, they expect when everybody gets back together there to be a resurgence and possible another lockdown. So it's going to be phased over probably about 180 days at minimum is what I think the CDC one. So I've been doing my research today to kind of look at what logistically and logically it might look like, and it's going to be a long thing. So
Yeah.
Hey, this is Ryan from Happiness is Camping. Going off of that, we met with a local camp director here who's on the board of ACA New York, New Jersey, and she said that the CDC is actually working with the ACA right now to come up with guidelines for camps on things like how to clean and how to screen for campers and what your policies should look like if you do host camp.
Interesting. I wonder if they're going to make that available, or if that'll be something people can see what they're recommending.
Yeah, they said that they would make it available, and I think it'll be available to the whole public, but if it's not, we're an ACA camp, so I'm more than happy to forward it to everybody so that everybody will have that information.
Did anybody see when that was going to be done? Because I read that email and I was kind of chomping at the bit to see a date where they were hoping to have that out. Did you happen to see that, or am I not alone in that we don't know?
So she said that it was in the next week to 10 days. They were hoping to get that out.
Okay, thanks.
The COVID Plus Camp Facebook group said by the end of April for that.
And I love hearing that, but my public health side says even with those kinds of criteria that there's still going to be some of the stuff that I've heard from people that have been working with the CDC is that they're looking at unique models of camp, like kids who are all seropositive for COVID, who have had immunity, who've tested and have had it and have a positive immunity, that would be a safe bet for camp. So I'm curious. It'll be really interesting to see what they come up with, because it just seems to fly in the face of all the other epidemiologic studies that are out there in terms of giving people. I don't want to give people false hope that camps are going to be able to happen if you just do X, Y, and Z. So it'll be really interesting to see those.
I was thinking the same thing. I mean, you're talking medical camps that are in a different realm than just your general summer camp. That adds a whole new layer. And are we really sure we can trust the antibody test yet? I mean, that brings up yet a whole nother set of questions. So.
Yeah, she even mentioned that they might also recommend creating a waiver saying that you understand that you'd be at risk if If you got COVID, it would be a possibility. And then in the same breath, she also said that that wouldn't stand up in court anyway. So even though they're doing it, they're telling camps, there's a risk that your campers could have an outbreak, that there's no guarantee unless a vaccination is created. So our med staff has already said that until there's a vaccine, we can't really have camp because we can't guarantee anything.
Wow. As a clinician, the last thing that I want to do is sign kids up for camp when I have to have them sign a waiver that says, hey, you might get really sick from this. But so Mom and Dad, do you mind signing this form for us? We had enough trouble getting people to follow all the measles rules that we had, which is becoming an issue again now.
I think we've kind of moved into the what topics people would like to cover, but this is a good discussion, so I don't want to derail it or stop it. Other things that people are thinking about, questions are on your mind? Amy, your question is COCA going to put out a blank statement about whether camp should be held or not? I'm assuming you meant held or not. There is a letter that Matt sent out. Matt, I think, is there a link on the website to it as well? Just talking about COCA's position about that.
I believe there is a link to the letter on the COCA website. Don, you can correct me if I'm wrong. That just states basically because of how varied our campsites are and our camp populations are, that we just encourage everybody to be as educated as possible and follow your state, local, province guidelines along with the CDC to make the most educated and safety conscious decision that you can for your campers. That's actually basically the letter in a nutshell. But the letter went out a week and a half ago, maybe at this point, maybe 2 weeks, if that. It went.
No, it was about a week ago, I think.
A week ago. Okay, a week ago. It goes out. I believe it went out to all the directors. But there should be a link on the website where you can find it. Yes.
This is Dina from Camp Tecumseh. Similar to Ryan in the group chat, our medical team as well has said, unless there's an immunization, it's not safe to gather anyone at camp right now. So we're looking at other options to do, virtual options and just share some things to keep everyone engaged and connected. But with like everyone, this is a learning curve, and what that looks like, we're still working that out as well. But anyone that was on the last town hall with Dr. Rafi, he also suggests that he's kind of on the front lines in LA, and then our local pediatric oncologist as well this week has also stated that we should not be gathering anyone at camp until we have a better understanding of what all of this looks like, unfortunately.
Other questions, topics people want to talk about?
This is Deb from Camp I Hope, and we haven't worked out the logistics or even if we're going to do this, but there was a lot of things on the news this past weekend about kind of drive-through services because it was Easter. And this is our 10-year anniversary, although we moved our 10-year anniversary forward a year. So we were trying to figure out if we could use one of the big stadiums and have everybody park and kind of have drive-through fireworks or drive-in movie fireworks to bring everybody together with strict instructions about not being in their car or not being out and that kind of thing. But we haven't quite figured that out. But just as kind of a kind of try to do at least one thing sort of special where they could at least see each other. But again, that's still in the planning phases, and we're not even sure if that would be smart.
How many campers do you serve?
We do siblings and camper and kids with cancer, so we usually have 125. So I don't know if that's how many families that would be, but
Anyone else thinking of kind of outside the box things you're trying to do to keep camp in people's minds, or at least give a little bit of camp to people?
The one thing, this is Rich, that when we talked about virtual camp, and I believe it was mentioned earlier today at another Zoom meeting, that brings a benefit to doing a camp like this structure is that we could also reach more kids that wouldn't necessarily be able to come to camp that are in the hospital setting. So one bright little silver lining to this COVID cloud is maybe we'll be able to, see more campers and engage more campers.
I'd like to throw a question out for the medical folks on the call. My question is, our camp, for instance, Kelly and I both run Camp Happy Times here in New Jersey, and we have basically made the decision but have not announced anything yet because our camp is so late in August. We're actually the same week as Fantastic is in Virginia. I kind of want to get the plan in place before we announce. But my question is, I'm starting to work on some like videos and that kind of stuff. Does anyone have an idea or a plan to get the medical staff involved in their virtual camp? I mean,
Yeah.
the fact that, their medical talents necessarily aren't maybe needed, but, because they're part of the family too. And I don't want to lose that in the process.
I so appreciate you saying that. And that was my first thing, as I said, you don't really need ice packs at camp when you're doing it virtually. So, but the med staff are going to be, they're just as upset about this. So one of the things we talked about is, and we've been doing it already, our medical director and myself and one of our other doctors are participating in the virtual campfires that we've been doing during the COVID thing. So we're going to do a song, lead a song and put it out. And so we're trying to find ways to, if people want to do it, that they can participate throughout the time. They don't have the whole week of programming figured out yet, but we definitely are keeping med staff involved in that. And I put that in the letter that I'm sending out to the med staff tomorrow that says, they may not need our ice packs, but they're going to need our mad singing and dancing skills. So, get yourself ready for it. So I really appreciate that.
Yeah, I'm looking at the chat. So Kara just says, I think she's bringing up a great point for those of us that are med staff. We love camp because it's our chance to see the kids being kids. So if you can figure out a way to keep your med staff involved, especially right now with all the craziness that they're dealing with outside of the camp situation, I bet it would be very appreciated. Okay, Sherry, you have to tell us more about what's the hug and tuck.
All right, hug and tuck. You guys probably all do it, but at night we all go around at camp, right, and do hug and tuck.
Okay.
So in the clinic, some of our nurses and our nurse practitioner and so forth went from room to room with pretend patients and did a virtual hug and tuck and did it progressive and then they actually submitted the video. And the polar bear plunge or the polar bear swim, different folks have done different things, kind of like, you know, dump a ice cold bucket of water over you. A nurse and I, 6 feet apart, mind you, got in a creek and got, you know, wet, and just different ideas, trying to think through how we can keep all of the kids engaged and they watch for things. And then Clean Cabin has been fun too, because we've only done it once so far, but they all submitted their Clean Cabin pictures of their rooms, which were very impressive. And then our KCA staff is going to send them prizes for the winners. So, you know, gift cards, things like that, that you can use right now, but tons of fun.
Very cool.
Cool.
We do a game at camp. I'm sure a lot of you guys do it. It's like the face the cookie, where you start with the cookie on your forehead and you have to move it down to your mouth without touching it. It's like a minute to win it game, but our campers love it. And so we're doing a virtual like challenge on social media with our campers and volunteers, and asking everybody to post their videos doing it and challenging 3 other people in the camp family, as just a kind of like, it's cool, we can still eat cookies and be silly during all of this. And we're challenging a lot of our medical staff to do that with us too. So that's been kind of fun.
So I wanted to bring up something that surprised us. We have a meeting every week with camps in New Jersey, and one of the camps received something from their insurance company reminding them that if they do a virtual camp, and if one of their campers gets hurt doing virtual camp, doing something like a challenge that the camp posted, that the camp itself is actually legally liable for that, which is surprising and a little bit weird that we didn't even consider when we were creating virtual camp.
Okay, definitely not something that I would have thought of.
I think one of the other things that I've been trying to do too, this isn't as fun, but we have a lot of med staff that are very invested in the processes that we have at camp. And every year we sit around going, we really wish we could do this, but we don't have time to do it because it's a really big project. And we say, well, we'll work on it next year. And then next year comes around and we never have time to do it. So one of the things, the positive spins I'm trying to put on this is, okay, well, now we have a summer that we can really focus on all the things that we do, you know, and all the policies and procedures and stuff that we have. And we can make this so that Camp 2021 is going to blow your socks off. We're going to put things in place and try to, you know, so I'm trying to get some of our, especially the nurses, you know, we like policies and procedures. So trying to see if we can get them involved in working on updating things and how we do it, and thinking outside the box of how we can do our medications differently and how we can do other things. So I'm hoping that is going to it'll keep our key people really engaged in the process, and hopefully kind of, you know, also if we do a couple of like Zoom meetings throughout the summer and engage people who want to come to camp and get their ideas, that will keep people waiting for the next camp, you know, because there were some new people that have never been that had signed up, and I don't want to lose them next year.
Great point. Anyone else using the time to revamp policies or do those I'll get to them someday projects? We were on the list for a gold ribbon visit, so we're kind of doing that anyway, but certainly taking even more time than we were with the change and the due date on that. And it is amazing how many times the same people who make the decisions at camp look at each other and go, well, we know what we do, but do we know why, and did we ever write it down? So that's where we are right now with that part.
This is Deb again. Previously on one of the calls about virtual camp, people had talked about sending out some, kind of camp in a box. And they brought up like how they would put that together and needing to have masks and gloves and that type of thing. And I wondered, one of my friends, I think they're from Camp You Can Do, had said that their camp actually put a sticker on the box that, or is going to put a sticker on the box that they're sending out that just says, don't open for 72 hours. I don't know if anybody had any thoughts about that, just trying to prevent stuff from living on surfaces. If that is something we need to be concerned about if we're sending items out to our campers.
So Deb, this is Susie from Camp One Step. So we actually looked at the U.S. Postal Service recommendations and actually kind of put something together from that and sent it out to our parents through our email blasts. The U.S. Postal Service actually, based on their recommendations from the CDC, said that by the time the mail gets to them, there's probably no danger in what they receive, but we are letting our parents know that everything is wiped down before it goes out, the box is wiped down, the things in it are wiped down, and then we make recommendations on the receiving end as well as just good hand washing and things like that. So you may want to look at the U.S. Postal Service COVID recommendations.
Deb, I think what you might be talking about from the last meeting, if I'm remembering right, and I know the group is on, Smile a Mile was talking about the preparation they were doing for boxes that were going to the hospital.
Right. So it was the hospital's policies and recommendations that those that were packaging the boxes, wore gloves, masks, everything got wiped down, Ziploc bagged, and sorted prior to packaging. Right. But that's the other thing to look at. If you're sending to the hospital, you need to look at the hospital's recommendations and policies as opposed to also, mailing it to kids' homes.
So do you all think that those kinds of precautions are necessary? It sounds like Susie, like you did, if you're sending them to their houses as well.
Yeah, I mean, we just, as I said, we went by the recommendations from the U.S. Postal and then kind of put our own little twist on it. I'm happy to send you what we did, Deb.
Thank you.
I was going to just acknowledge some of the things that we're doing. We hope to include our medical volunteers if they have time and availability in the virtual activities that we do. We've already started some virtual, and we actually had our Camp Craft group got together, and our medical team was actually involved in that last night through a virtual Zoom meeting. But we also are doing just a lot of recognition right now. We have volunteers that come from all different specialties and not just the pediatric oncology. So I've got nurses from ERs and ICUs and stuff like that. And so we are actually, reaching out to them on about an every 7 to 10 day basis via email, sending them just kind of uplifting words and inspiration. And we actually now do Medical Mondays on our website, so we can post pictures of our medical staff in action. And then now I'm actually right in the middle of doing a writing campaign to everybody that they'll get something in the mail. So just again, trying to recognize the work that they're doing right now.
So I'm sorry, I was, the Medical Mondays, you said you started doing that, and that's what your staff are doing right now versus what they would have done at camp?
Yeah, we're just posting, kind of recognizing the medical efforts, just trying to let them know that we're thinking about them right now as they're kind of on the front lines, and just sending them lots of good thoughts, and then posting just various different photos of our medical team on Mondays on our social media sites.
Okay. So that brings a question to my mind, and people are throwing out some really fabulous ideas here. Do people think that they're going to do this long term? Is this just for this summer because we're trying all kinds of crazy things? Maybe people haven't even thought about that yet because we're just trying to get through the current situation. But I'm curious, like, for example, do you think Medical Mondays will continue through the winter, or other people that are doing some really great stuff?
I could see us continuing Medical Mondays for a while. We may have to periodically bring something else on board, but yeah, no, I think we will probably try to continue that.
Yeah, my goal is to actually take what I can do virtually this year and use it to expand my camp, and use kind of like the videos and the, you know, the teasers and the fun things and the songs to last throughout the year, to keep kids and families engaged as much as we can. We're a very large camp, so some of it's hard to do. So I'm thinking that, you know, these kind of videos, and I love Medical Mondays, to highlight our medical staff. You know, I'm thinking the plan is to use it year round.
Other cool things people want to share so we can make sure your good ideas getting used and you get some credit for your creative thoughts?
So, hi, I'm Marilyn from Camp Kids Are Kids,
Hi, Marilyn.
Chicago. So each year I create like a theme for medical, which kind of correlates with our theme for camp. Like last year we were Reach for the Stars. That was our theme for camp. And I had medical be medical administration receiving station. So we were Mars.
Okay.
And then each cabin gets like they have a little picture with a mailbox on it, and they get mail for the day, and the mail is like a clue to, like, I don't know, like for instance, like the first day was 3, 2, 1 blast off. Today's destination is Mars. So when they came to Mars or medical to get their medications, they would get like a little toy or a little treat or a little, I don't know if you guys can see this. I don't know. Can you see that?
Yeah.
So that would be Monday. This would be Tuesday. I don't know if you can see Tuesday.
Okay.
Can you see it? It says like, can you see what color Mars is? And then they had cool little flashy eyeglasses. Wednesday, Mars named after the Roman god of, and it was like a hint from Marvin. So they got Warhead candies. So just little things like that, you know, just to kind of make medical fun when they come get their meds.
Yeah.
So maybe they can get a little care package from medical, you know, sent to them. I don't know. Rich. Kind of crazy.
Hey,
but
we
fun.
like the fact that people are thinking and doing something different. I mean, probably a lot of us, you kind of get the reputation as being the one who makes all the rules and has to say no to things. And it's a lot of fun to get to do something a little different and especially let the kids see you in a different way than they're used to seeing you at visits and in the hospital. So I'm all for, Kara says we're the fun police. Yeah. Unfortunately, probably accurate, but you know, then again, it's also a great time to maybe lose that fun police hat and just be fun at camp as much as you can. So I'm really encouraged to hear how many people are thinking to include their medical staff in the virtual camps and some of that. So, because I think, like I said, and a lot of us have said, we're going to miss our traditional camps. So it's nice to keep engaged and to have something different to do than yet another meeting about whether or not you have to wear a surgical mask or a PAPR or something else that we're all talking about all day long. All right, well, this has been a great conversation. We're kind of coming towards the end of the time that we had scheduled. So I just want to throw out, are there other topics that you'd like us to focus on with upcoming town halls, or do you think we should keep doing this? Probably our first question. And then if so, what kind of things do you want to talk about? Or is it just really nice to have a time to chat and come up and talk about whatever comes up?
It kind of sounds to me that the vast majority of camps have already or are leaning on canceling. So I think the big thing on all of our minds is going to be virtual camp and what does that look like, and how we post that. And I know that people have awesome ideas, and I would love to be able to pass those around.
Good point. Other thoughts? And remember that there will also be some specific town halls about virtual camps and things too. So hopefully you'll have more than one place where you can hear that information.
I do appreciate, I told Matt, I really appreciate you guys doing this, and I think it is nice to have the option. It may peter out after we, kind of figure out what our new normal is going to look like. But for right now, while things are in such flux, even though a lot of us are canceling, it is really helpful to kind of have as we're fielding questions from our colleagues and from kids and families, it's kind of nice to have a group of all camp people that understand what we're all going through, kind of a collective grieving and a collective sharing of ideas and stuff. So I think it's really helpful.
Okay. Yeah, that certainly seems to be the comments coming in on the chat, is that people like the support and the just chance to have someone to talk about, that you don't have to explain what it means to be at camp and have some of these decisions. So looks like at least with the group that's currently on, the idea is to keep going forward with doing them. There was a question about having an update from an infectious disease doctor, which I think that would be great. We'll be happy to reach out to either one of the folks that were on our last calls, or if there's someone else that's interested, so we can make sure we're all getting good up-to-date information as well. Thank you for that idea.
I think it'll be really important too, maybe in the fall. I mean, I think going forward, it'd be nice to have the calls, but also in the fall, as we see what kind of a resurgence we get, and when we hear about the guidelines from the American Camping Association, is what is camp going to look like next summer, and how are we going to have to change what we do, or will we have to change what we normally do?
Okay. That's a great topic to keep on the list that we do a little bit later on. Other things people would like to hear about or talk about in the future?
If anything comes up after the town hall, please feel free to reach out. Dr. K, myself, Don, or Jennifer, if you have any ideas or thoughts on ways to add value to these town halls or topics to cover, just let us know, and we'll be more than happy to put those into place. Right now, our next medical town hall is scheduled for the 29th of this month, 2 weeks from today. By then we probably, between Dr. K and myself and folks, we could find one of our infectious disease doctors to join us for a bit to offer some insight as to what's going on. And then there's 2 more in May. But we also would encourage you all, there are several other virtual conferences and town halls that are set up, and sessions having to do with fundraising and this whole idea of a virtual camp, as well as some self-care workshops that are coming up. So please, be on the lookout for those. We want to make sure, as many people that want to attend have the opportunity to attend and learn from one another, and in turn then, take care of your own staffs.